Welcome to the Pharmacy Frontiers podcast, a podcast dedicated to the profession of pharmacy. Today, we're excited to turn over the podcast to the students from the St. Louis College of Pharmacy at the University of Health Sciences and Pharmacy in St. Louis. We give credit to the professors Stephanie Lucas and Terry O'Hollick for mentoring these students for these leadership podcasts. Let me remind everyone that the Pharmacy Frontiers podcast is available for streaming on your favorite podcast streaming app, whether it be Apple, Podbean, Spotify, or YouTube. The comments and opinions shared today are those of our hosts and our guests and are not official statements of the Missouri Pharmacy Association, Mitchell Pharmacy, Mercy, nor the University of Health Sciences and Pharmacy in St. Louis. Today, we welcome 4 students from the university to share their dose of knowledge off the script.
Hello, and welcome to today's episode of A Dose of Knowledge, titled Off the Script. My name is Kate, and I am here today with
Sydney,
Amber,
and Josie, and we're all P2 students at the St. Louis College of Pharmacy. Today, we will be discussing the importance of the relationship between pharmacists and patients and how to navigate this.
There is a stigma attached to pharmacy that all pharmacists do is stand behind a counter and count pills or press buttons on a computer. Today, we'll be using real-life stories to show the true impact of pharmacists' care on all their patients.
hundreds of career paths the pharmacists can choose, and each have a slightly different look when it comes to patient relationships. A little bit later in the episode, we will be sharing responses we got from 2 practicing pharmacists. One of them is in the community setting, and the other one is in the ambulatory setting. They discussed how they view their relationships with patients. Community pharmacists are more accessible than any other healthcare professional and see patients more than their doctors. Ambulatory pharmacists are in a doctor's office setting. The ambulatory care pharmacist that we will be hearing from practices in obstetrics, which involves participating in the care of women throughout their pregnancies.
Before that, let's dive into all the aspects of pharmacist-patient relationships.
Pharmacists are expected to provide patient-centered care rather than strictly dispensing medications. This can be through patient counseling on new medications, medication therapy management, which is a service aimed at optimizing medication therapy and improving patient outcomes, or simply by answering patient questions.
It is important to build strong relationships with patients, as pharmacists are the most accessible healthcare providers. A patient is much more likely to take their medication correctly, get refills on time, and communicate any issues with their pharmacist if they have a good relationship with said pharmacist. According to an article titled Trust Building in the Pharmacist-Patient Relationship, a qualitative study, published by the Iranian Journal of Pharmaceutical Research, this involves allocating enough time to the patient, providing understandable answers to the patient's questions, listening to the patient, and providing sufficient information. Doing this will revolutionize the patient's adherence to treatment and patient's compliance, and will upgrade the pharmacist's professional role in the health system. There are many different things that make for strong pharmacist-patient relationships. The first one we would like to discuss today is trust. Trust between a patient and pharmacist ensures the patient will reach out to the pharmacist with any concerns, tell the pharmacist important information that can impact the outcome of their care, and develop a sense of comfort. A pharmacist can get important information from the patients, such as alcohol and drug use, adverse reactions, and honest questions they have, if they have a good relationship. According to that same article Amber just referenced, if pharmacists establish an effective and good relationship with patients, respect them, listen carefully to them, and behave honestly, they will be trusted by the patient. In this type of relationship that builds trust, the patient is considered as a part of therapeutic decision-making.
When asked about how building trust with patients improves patient relationships, Dr. Alicia Fornash, an ambulatory care OB pharmacist, states that when a patient believes that a healthcare provider listens and cares, the patient is more likely to discuss any potential concerns and any issues that may impact the plan. Additionally, I believe that patients are more likely to participate in their care, follow their plans, and have higher satisfaction with their care. A patient is more likely to have autonomy if they have a strong relationship with their pharmacist. This means that they are much more likely to make informed decisions, such as being adherent to their medications, receiving necessary vaccinations, and more. It is important that each patient is comfortable with the care that they are receiving. An article titled "The Effective Patient Psychological Contract with Pharmacists on Medication Adherence, a Qualitative Study" states that if pharmacists fully fulfill their responsibilities expected by the patient, a positive impact will be definitely exerted on medication adherence.
Empathy and compassion are key traits that a pharmacist needs to have when attempting to build strong relationships with patients. Often, when patients come to the pharmacy, they're experiencing some kind of sickness or have a stressor in their life. Because of this, it's important to make patients feel as though the pharmacist feels for them through their situation and understands them.
When asked how having empathy for her patients improves patient relationships, Dr. Brittany Muschel, a community pharmacist, states, "Having empathy clearly shows you understand the patient. It also goes back to being respectful. Having empathy can 100% turn a situation around. If someone comes to the counter in a terrible mood, some people will assume that they are just rude. But if we look at it from a different perspective, we do not know where or what the patient just came from. Maybe they just came straight from a doctor's appointment and got some terrible news. Maybe they are taking care of a sick family member. If we are kind and show empathy, we may change that patient's whole day."
That is very important to keep in mind when we are interacting with patients. By showing empathy and compassion, a patient is much more likely to build a positive relationship with you as their pharmacist. I know I would much rather trust someone who shows empathy to me than not.
Before we continue discussing some of the things that lead to strong patient relationships, it is important that we highlight the fact that many of these traits or actions are interconnected. Most of them all lead back to building trust, which in turn leads to better patient outcomes.
Professionalism is an important trait to possess as a pharmacist with good patient relationships. Displaying professionalism through appearance, gestures, and conversations will encourage patients to receive advice as credible, which will in turn strengthen their trust. This helps a patient truly listen, building a greater understanding of the medications they are taking. It is important to demonstrate professionalism with patients, but also still be able to form those connections with them. Dr. Fornash, ambulatory clinic OB pharmacist, states, "Being professional helps the patient trust the healthcare provider. However, I think there is a fine line between being too professional and appearing to be too cold."
Lastly, going hand in hand with professionalism is respect. Respect is a value that is often overlooked, but it is crucial in maintaining strong patient relationships. By emphasizing to patients that you hold respect for them and their care, patients will be affirmed that everything the pharmacist does and asks of the patient is crucial to their care.
Tying this back to trust, Dr. Muschel, community pharmacist, when asked about how respect builds strong patient relationships, said, "Having respect builds trust. Patients are more likely to trust your opinion or advice when you clearly show you respect their autonomy. No one is going to trust or build a relationship with someone who is not respectful. According to the National Library of Medicine, trust is important for safe and effective healthcare. If patients have weak trust in their providers, they are less likely to listen to advice, on guidance from the providers, or even engage with the healthcare system at all."
Now that we have discussed a few of the many crucial aspects of patient relationships, we must talk about potential roadblocks to building patient relationships. Some of the major barriers of mastering patient relationships are time constraints, language barriers, lack of reciprocation, and boundaries. A pharmacy can be a fast-paced environment where the pharmacists are interacting with many people from different backgrounds, which makes it very important to prioritize every patient interaction.
Dr. Muschel, community pharmacist, states, "Time constraints, labor, and meeting certain metrics are always a factor in community pharmacy. I think it is important to make sure, despite each of these challenges, we take the time to fully listen to our patients, counsel them, and make sure they feel we are truly there to improve their well-being. I could keep up with my cues much better if I did not take the time to counsel my patients and build those relationships. But morally, my job is to make sure my patients know what they are getting and how to use their medications appropriately. I make that and building those relationships my priority."
Dr. Fornash, ambulatory clinic OB pharmacist, states, "Each roadblock situation requires a little bit of a different approach, just as each patient in these situations may respond differently. I work in a teaching clinic, so visits are often long. Additionally, patients may have appointments with several providers during that day. During each visit, I try my best to demonstrate empathy and work to build a relationship. I try to listen to any concerns or problems that my patient may have that is impacting her care and try to help resolve those. My students and I often work to resolve pharmacy and insurance issues and also helped with other problems like finding a dentist. For some of my non-English speaking patients, we have prepared pictorial medication lists with the words as well. We have called pharmacy specific manufacturer tablet is being used so that we can add a picture of the tablet with the number needed at the various times of the day that the patient needs to take it.
While there are many roadblocks, a few which we discussed, a good pharmacist like those we talk to will find ways to work around these barriers, creating strong patient relationships and great patient care.
Having these patient interactions causes the pharmacist to have some pretty touching stories. We asked Dr. Mushel and Dr. Fornash to share a story with us that touched them during their time as a pharmacist. Dr. Mushel, community pharmacist, stated, "We had a couple that were longtime patients. The wife passed away, and when her husband came in the next time to pick up medications, we had a plant and a sympathy card for him. We all cried with him as he tried to express his gratitude that we cared. For years after that, he would buy a box of chocolates at the front store and have a grocery bagger run it back to us. Even when he went on hospice and could not come into the store, he asked his son to continue doing that. Acts of kindness like that really show what a difference we make in our patients' lives."
Dr. Fornash, ambulatory care OB pharmacist, stated, "I had a pregnant patient with a complex medical history and medication list. She was referred to me for uncontrolled asthma. Although I am referred for a specific problem, I still assess and provide recommendations on all of her medical problems, as well as pregnancy-induced conditions and preventative health. This patient was having asthma symptoms several times per day, and it was waking her up 1 to 2 times per night. As a part of my visits, I listened to the lungs for my asthma patients. While listening to her lungs, I heard wheezing throughout the lung fields. The patient started having an asthma attack during the visit. The team and I ordered a nebulizer treatment during the office. While we were waiting and during her treatment, she asked me to stay with her. I also noticed that her eyeglasses were broken, and she was using a pencil for one of the sides of her glasses. It was too soon for her insurance to let her get another pair of glasses. I reached out to the Lions Club and was able to provide her a phone number to work with the organization to get new glasses. She was also having problems with her pharmacy, so I called and helped resolve those issues. This patient asked me to see her at every appointment during her pregnancy. Additionally, she asked to see me at her gynecology appointments to give me updates and show me pictures of her baby."
Building trust, having empathy, displaying professionalism, and overcoming roadblocks with patients all have a positive impact on career satisfaction for pharmacists. Many patients rely on their pharmacists to be the most accessible healthcare provider. They look for that familiar face when they come into the pharmacy that they have been seeing for years because they know they will be receiving excellent care from a trusted provider. Working at a community pharmacy, you get patients every day who come in and ask where so-and-so pharmacist is, or will call and ask if that pharmacist is working that day. The same idea goes for clinical pharmacy. As we heard from Dr. Fornash earlier, patients will come in for a completely different service and will still ask where their pharmacist is. The bond between a patient and their pharmacist is so special and is something you don't see everywhere in the healthcare field. The patient interactions can be one of the most fulfilling parts of the job, which is something that drew all of us into the field of pharmacy.
If you are interested in healthcare and want a fulfilling career where you are going to be fostering long-term relationships with your patients, we would strongly encourage you to consider pharmacy. If you think pharmacy could be your niche, go check out some of the other episodes of our podcast, A Dose of Knowledge, for some more insight into the field. Our peers have a lot of great information to share about their career path as a whole to hopefully answer any questions you may have. Thanks for listening. We hope you enjoyed learning about pharmacist-patient relationships and will consider pharmacy as your future career path.
Thank you, students, for hosting our podcast this afternoon. And thank you, listeners, for joining us. Please share this episode with your friends and social media outlets. And seek out the other Dose of Knowledge podcasts on the Pharmacy Frontiers podcast page that can be found on your favorite podcast channel.